Are live. Welcome everyone to our committee meetings of Monday, July 15th. And we have a special health services committee meeting that we'll start off with.
Good evening, everybody. We have Health Services Committee meeting at 6 o'clock. We have no agenda items, but we have Mark Evans here, who's the president of Greene County Emergency Medical Systems, and he is going to give us a presentation on the 2025 budget for Greene EMS.
A lot of pictures. I can't read a lot of pictures. Look up there too. Like you're Thank you. What happens to you? Thank you.
Good evening, everybody. Thank you first for having us. Have with me tonight our Vice President, Nick Delasanti, our Chief, Steve Nair, he just handed out the packets, Dr. Paige Reinfeld from Albany Med, and Nicole Stoyich, who is our Financial Secretary now. She replaced Ron Rouse, retired after about 25 years with us.
Wow, it's really 25 years.
Yep. So we traditionally come and do a quick review of the prior year and then go through our budget request for the coming year. As you know, we come at this time of the year because the towns need to get their budget numbers. So we adopt a budget and then get those numbers out to the towns fairly soon after we've been here to the legislature so that they can start preparing their budgets for the fall. This is our board of directors for this year. Not really too many changes. I'm going to kind of zip through a couple of these slides. If you have any questions as we go through, by all means, just stop me. This is always an interesting one, the call response times. And as you can see, the valley and the mountaintop area, we almost have call parity. In fact, it's close enough, I would call parity. So the average response time on the mountaintop is 8 minutes and 19 seconds, and in the valley, 8 minutes and 26 seconds. So that's very, very good for a rural county, rural area like we serve. That is very, very good.
I'd like to say thank you, Mark, as a mountaintop resident and all my constituents. Thank you very much. The efforts that we put in the last 3-4 years are right there. There's a tell.
That's the difference right there. That, in fact, thank you for supporting the truck that went into
Because
that
was a big difference before. Now it's,
absolutely.
thank you.
Absolutely. Thank you. Just quick numbers on calls for each town. You'll notice Coxsackie is way up. We have the 2 correctional facilities, which contribute tremendously to the call volume along with the emergent care.
Mike, Mark, so you're required to go to the prison also?
Yep.
For an ALS call?
Yep. And if it's determined to be an ALS call, yes.
That's insane.
And we've had a lot of interesting issues with access to the facility. So about 6 months ago or so, I think we implemented a policy that if we can't get into the facility to get to the patient within 30 minutes, we leave. Because we're sitting there holding that paramedic for nothing when maybe there's a cardiac arrest, 5 miles away that they could respond to instead of sitting in front of the facility, not doing anything. Things have improved a little bit, but they're still not where they should be. If they need to listen on the scanner, the information they get for the dispatchers, it's not the dispatcher's fault, but the information that they get is terrible. Unknown age male with chest pain.
Don't they have a facility of their own that they could be taking care of a lot of this stuff themselves?
They both have medical, areas that are staffed by nurses and doctors like during the day. But if the doctor determines that they have to go out to an actual emergency room.
So we're just transporting. They don't have transport.
No.
So that'd probably be a good thing for us to bring up to the state to say, why don't you transport your own people?
Yep.
Or pay us what we're worth to do the calls, right?
Right, Sean is well aware of these issues. We've kept an update on the issues we've had.
Mark, what would you say though with something like that? How many times would you say it's required you to have to move your chessboard around because your paramedic was held there? Have you found that?
I couldn't tell you right off the top of my head, Mike, but it's, it's fairly frequent,
Enough to set policy.
yeah. Yeah, I mean, we waited,
We had to determine 30 minutes, we're gonna go.
right.
Yeah.
There was one instance, 6 months ago or so, that it was actually a cardiac arrest. And it took an hour for the medic to get access into the facility. And he's probably one of our most experienced medics. He's been a medic for, I think, 35 years. He's a flight medic as well, currently. He got in, took one look, put the monitor on and said, nothing I'm gonna do. Not after an hour.
Yeah.
So we have tried. We have gone there for meeting after meeting, sent letters. Greene Correctional's a little bit better. Coxsackie just struggles completely with access and notification and the correct information.
Couldn't you shorten the wait time? I mean, 30 minutes seems like an excessive amount of time to wait. Say, listen, if you can't get us into 15 minutes, don't call.
Right. There actually is a facility, agencies down the line. What correctional facility was it, Steve? Greene Haven, where the EMS agency that served there outright refused to respond there any longer. I mean, just sent them a letter and said, we're not coming. And the agencies around them had to start filling in. And of course, those agencies quickly were like, wait a second, this is not our responsibility. It created a real mess. We're not really sure how it got resolved or if it really has yet, but it's just, the state just doesn't really care about it, fortunately.
We're looking at the numbers, Coxsackie was obvious, but Harrow, 840?
Yep.
Why? Like, is that just regular old calls every?
Very low calls.
Wow.
Yeah, in fact, Coxsackie really jumped this year. Carroll was, I think, the most last year.
Yeah, they're always neck and neck.
They were, yeah, it was very close, very close. So the truck in Coxsackie Medic 5 wins the award this year for the most busy.
Battery goes quick.
Okay. Just quickly, some of the procedures that paramedics can do, our medics can do. On the left-hand side and on the right-hand side, this year I decided to actually put up the list of medications that we carry. Carry 35 different medications. On the right, top right is the narcotics, morphine, fentanyl, Versed, and ketamine. And those are very powerful narcotics that we use in various situations, airway management, pain management, etc. Picture on the left, that's our standard LifePak 15 cardiac monitor, about $40,000 a piece. We lease ours, or we have leased them in the past. We currently own the ones we have. Next year, they're coming out with LifePak 20, which will be the next and updated version of this. This machine will do 12 EKG. We can hook it up to somebody sitting in their living room couch, and we can bring it up and determine if we believe they are having a heart attack. And if they are, and the machine's telling us that, also based on the paramedic's assessment, many times now, patient is transported to the hospital is notified, and the cardiac catheterization lab is prepared and ready, and they bypass the emergency room. They do not stop in the emergency room. They go right past the hall and right to the elevator and go right up to the cardiac cath table and over the cath table. A few weeks ago, the chief and he had a student with him, and they got to stay and watch the cardiac cath and see how badly the gentleman's heart was blocked, and watch them put some stents in. Yes.
So is this like software where it talks from them to the hospital, like they can see when he's on his
Yeah.
way or she's on her way, the patient's on their way?
This machine will transmit the 12-lead EKG to the hospital. The doctor can read it. They also have a new app on their phones that they can put in all the information on the patient and send it out without having an actual conversation. A conversation takes a long time. So they have an app now that will send the information out to the hospital, and then they can give updates too on the way. What's the name of that, Steve? Pulsera. Yeah. It's become a standard thing in the region. The device in the middle is the T-pod, and the T-pod is used for pelvic and hip fractures. And of course, as you know, in the wintertime, we get a lot of those off the ski slopes. And it's just a very simple device. You wrap it around and you pull the string tight. But most times when people have pelvic fractures or hip fractures, they're incredibly painful. And the ride down from the mountain down to Hudson or to Albany is not very comfortable. And usually we're using a lot of morphine to keep them comfortable. They've applied this and cinched it tight, and people have literally gone, "What'd you do? What, I don't have any more pain." And so you're preventing from having to load them up with narcotics on the way to the hospital. So really, really simple device, costs about $70, but it's made a huge difference in the field with people in pain management. Rescue Pod on the right is a really interesting device. It is used only in the case of witnessed cardiac arrest. And once the patient's intubated, that gets put on the end of the tube and you ventilate through that. And what that device is designed to do is to keep more air, more oxygen in the lungs. And it's been very successful. We've had many cardiac arrest reversals. Now, is it directly attributed to this device? I don't know, but we're having good success with it. And it's another tool in the toolbox to, in those situations. This is the big game changer that we just got on the truck. These are Hamilton T1 ventilators. If we recall, last year we got 3 LTV ventilators donated by Columbia Memorial Hospital. As soon as we got them on the trucks, the medics were like, started using them, and we started having great success with them. So far, we've used them 14 times, and 10 of the 14 patients have been discharged. What this does is you can use it in this case of a cardiac arrest to ventilate the patient. But let's say somebody's COPD or an asthma patient. For instance, a couple weeks ago, we had an 18-year-old asthma patient in Prattsville that was unconscious. Our youngest medic got there. She's 21 years old. She's about this tall. And she got there and got an IV in the guy, got him on oxygen, got him awoken, and then put the mask on, and it works just like a CPAP machine. I'm not going to ask any of you who have CPAP machines at home, but if any of you do, you understand how they work. Same type of thing. But this machine will evaluate the patient's lungs, the resistance, and make adjustments. It's an incredible machine. She got him on it. She kept him going, and she medicated him 14 times in 1 hour between Prattsville and Oneonta Hospital. 14 different medication administrations. Kept him from having to be intubated and put on a ventilator at the hospital. And the doctor there felt as though that it had saved his life. 18 years old, and he's that sick from asthma. The very first use we had of it was a 46-year-old female who was in cardiac arrest in the village of Catskill. Catskill ambulance got there, paramedic on Catskill ambulance called for one of our trucks to bring a ventilator. Put that ventilator down, and they successfully resuscitated the lady. She was in CCU and Albany Med for a couple weeks and had a valve replacement and successfully discharged back home. So this machine is a game changer. So far this year, we've had 6 cardiac arrest reversals. and 4 have survived to walk out of the hospital neurologically intact. So they're walking, talking, just like nothing happened.
Good eyes.
Very good. What's next? So the legislature approved blood to be carried by EMS units to the field. All units are not going to carry it. What they decided to do, because if they tried to put blood in every ambulance, it would crash the blood supply. Not to mention that the refrigeration needed to carry blood is expensive. It's like $15,000 unit to put in. So the regional medical control is going to decide on who's going to carry it in each county and how it will be carried. We're a pretty prime candidate because we can cover the entire county and because we're so mobile with the medic trucks. So we're waiting to hear, but very, very good possibility that we will be one of those agencies that gets it. Rural paramedicine, we're still working on this. We talked about this last year. We're still trying to have some discussions with the hospital about following up people that get discharged home and preventing readmissions. We've got some new medications coming. Acetaminophen. I'm not even going to try and pronounce the second one. And then the last one is Ansef. Every year there's an evaluation of the medications that the medics carry. Old ones are thrown off, new ones are added, and these are in the pipeline. We are participating in a very interesting and exciting program through Albany Medical Center. They have an EMS fellowship program, and the young lady, Dr. Paige Reinfeld, has been assigned to our area down here, and she is going to be here for a period of time. And she's going to help us with training, and she's also going to be in the truck and responding to calls approximately 1 day a week. But I want to introduce her, and Doctor, would you like to just give us a brief synopsis of what you're going to do?
I'm Paige Reinfeld. I'm an emergency medicine doctor. I actually trained not too far away down at Vassar. I just started this fellowship about 2 weeks ago. I live in Ulster County, so I'm kind of in between the two. So this is kind of just on my way. But I'll be partnering with Greene County to do both offline and online medical control. So offline medical control is kind of working on some of these projects that we're kind of looking at what's next for the county, along with some of the administrative side of things. And then the online medical control, which traditionally has been calling into either Albany or CMH to talk to a doctor about what to do next once they kind of get past the protocol part of what you're doing on scene. But also the cool part is Albany Med is providing me with gear, medications, handheld ultrasound. I have a field amputation kit to respond in the field in this area. So hopefully at least once a week I'll be down here. Hopefully I'm always available by phone to come to some of these bigger calls, but I'll try to catch some of the routine calls as well, and just help provide optimal medical care for the community, which they're already doing a great job with.
Thank you. Just a brief slide on our contract history over the last few years. These are obviously some of the cost drivers that affect our costs. Our vehicle cost, each vehicle one has gone up in the last year and a half by about $10,000. Mandatory training has gone up. Station leases, the renewals on those are due. Those have gone up. Medical supplies have gone up, obviously. Health insurance. Really, I mean, you folks know as well as I do where the increases are coming and where it's cost.
Is the overall, what's the word I'm looking for? The state rate for Medicaid, Medicare, the reimbursement, is that really, you know, where somebody has insurance or they don't, is that really a driving factor as well?
Not for us, because we don't bill.
That's
We don't bill.
Individual transporting agencies that do the billing.
We provide the pre-hospital care report to the agency that did the transport. So whatever agency did that transport, that medic will complete the report, send it to that agency electronically, and then they do the billing from there.
Right. Yep, that's right here, Trump.
So we're looking at is what we're continuing to see is the agencies serving us are continuing to increase pay. And we allocated money last year for a pay increase. Over several months, our board developed the budget draft that we have. And our board decided that we really needed to dedicate an increase to $2 an hour increase for the medics. So that entire increase is dedicated to a pay increase for the medics. We have some of the best medics in the entire state. We pull most of our medics from the Skill paramedic program. A lot of them will come down and ride with us. The head of the program and the head of the clinical for the paramedic program there work for us part-time. They do about 1 shift a week. And when students in the paramedic program there ask them where they work, they go, oh, Greene County EMS. And they're like, Greene County? You work in Greene County? And they're like, don't knock it till you try it. So once they hear that those people running the program work here, they then become very interested and they start checking us out. And then there is I say competition or fight amongst the students about who's going to come down and do their paramedic ride time here at Greene County. So we end up taking, how many, Steve? 3 or 4? 5, 2 or 3, 3. And they ride with us and we evaluate them and see their skills. And most times they finish, they graduate, and they want to come work for us. And we've hired a tremendous amount of them. So it's a very good working relationship between us and that program. That's what we're requesting. And last slide, last year we were the Regional Agency of the Year. We also got the award for excellence in quality and safety. Kate Merchant, who's been one of our medics for several years. He was the Regional Paramedic of the Year. And this year we're celebrating our 25th anniversary. So as we did a number of years ago, we're going to have a dinner in October to celebrate. We'll extend an invitation to all of you. Hope you will attend. And really also, you folks are responsible for us and what we do. And we appreciate your support. This is one of the best organizations I've ever been involved with. It's why I continue to stay involved, because the people on the paramedic board are dedicated to just making sure that we have the best trained medics and the best equipment for the people of our county. Without having a hospital, that's obviously a very crucial thing. We think we do a good job at it. We've been recognized for that. And we look forward to continuing on. Any questions I can answer?
Thank you, Mark.
Okay. Chairman, thank you. Thank you. Thank you, everybody. Thank you all.
Thank
you, Mark.
Thanks, Mark.
Anything else come before health services? Adjourn over. That ended by Bloomer. We are adjourned.
Right. Hi, everybody. I'd like to open Economic Development and Tourism Committee meeting at 6:24. We have one action item, but before that, Warren would like to say a few words.
Sure, just 2 quick items. The legislature authorized us to release an RFP for the Durham 145 corridor project. We put that out about 4 weeks ago. It's really called an expression of interest for this project. The expression of interests are due this Wednesday. So we formed a little committee. The committee is representative of planning, highway, public health, a town representative from Durham, and of course legislator Handel and a DOT representative. So we're going to get the proposals. They all go out to the engineering firms that are on the Region 1 roster of engineers, and we have been getting a fair amount of interest. So they'll come in Wednesday. we'll score them, we'll put together a little matrix, get this committee together. The committee will make a recommendation of which firm to select. It's already a predetermined budget, 50,000 from DOT and 10,000 from the county. And then we'll bring it to the legislature in August for, with a resolution for a recommendation to hire the firm. And then we'll begin that corridor study project. And today I received an invitation to the new Cold Center building. Member Betsy Jacks was here at a previous meeting. They're doing a ribbon cutting Monday, July 2nd at 10 a.m. on site. So I know she had-
July 2nd?
July 22nd, thank you, 22nd, at 10 a.m. I asked them to send an official invite to Tammy so that Tammy could push it to you, but it's only a week away, so I want to make sure that you know there.
Thank you, Warren. All right, on to proposed action items. We have one, declaring lead agency and negative declaration determination of environmental impact under State Environmental Quality Review Act, SECRA, for Big Valley Trailbreakers Snowmobile Club Trail Development and Maintenance.
Village.
Handle.
Bulich and Handle, all in favor?
Aye.
Opposed? That's passed. Anything else to come before Economic Development and Tourism? Motion to adjourn? We are adjourned. Thank you.
Who was my second?
I didn't get a second.
Okay.
Ed.
Good evening. I'd like to open the Government Operations Committee meeting at 6:27. We have two proposed action items. I'll go right into them. Authorizing, number one, authorizing the sale of a portion of approach to Greene County Highway right-of-way by private sale.
Overlaw.
Martinez. On Martinez. So any discussion? All in favor?
Aye.
Is anyone opposed? Okay, number two, authorizing a one-year extension to county administrator's current term.
Take it over.
Lennon and Martinez. I'm gonna second that too.
I'll second that as well.
Only 1 year? 1 year added.
A one-year extension.
Lennon.
I have Lennon, Ovid,
Who second?
Martinez second.
Lag.
Nez, Davis, Leg,
Overlaw.
Overlaw.
Yep.
That's everyone.
That was the committee. Is anyone opposed?
Tom. Raise.
Does anybody have anything else to come before government operations?
Motion to close.
Second.
Thank you.
Wednesday night.
Ready, Tammy? Okay, we'll call Finance Committee to order. Several items. Proposed items. First is authorize the sale of a portion of the Greene County Highway right of way by private sale.
Overlaw.
So
Village.
Bulich and Davis seconds it. All in favor of that?
Aye.
Oh, that's carried. Number two, authorize agreement between Greene County and the Columbia Green Community College Foundation and authorizing payment.
Over.
Village.
Hobart, Mr. Bulich, second. All in favor?
Aye.
Opposed, that's carried. Three, authorize the purchase of equipment, 911 backup center. I'd like to take that.
Leg and
Mr. Lake. Myself. All in favor of that?
Aye.
Oh, that's carried. Four is authorize implementation and funding in the first instance, 100% of the federal aid and state Marchicelli program aid eligible costs of a transportation federal act project and appropriating funds therefore.
Hobart.
Davis, Mr. Hobart seconds it. All in favor of that?
Aye.
Opposed, that's also carried. Number five, rescinding resolution number 108-23 entitled resolution authorizing implementation and funding in the first instant, 100% of the federal aid and state Marchicelli program aid eligible costs of a transportation federal aid project and appropriate funds therefore.
Hobart.
Mr. Hobart.
Davis.
Davis seconds it. All in favor?
Aye.
Opposed, that's also carried. Number six, authorizing purchase of two used yard tractors, pretty cheap.
Hobart.
Lennon.
Hobart, Mr. Lennon seconds it. All in favor?
Aye.
Opposed, that's carried. Number seven, accepting formal proposal from Great Manning Engineering for engineering services necessary for the placement of driver feedback signs on County Route 23B, Main Street, Town of Carroll. I'll second that.
Lennon.
All in favor?
Aye.
Opposed, that's carried. Number eight, authorizing or awarding bid for number two diesel fuel.
Hobart.
Hobart.
Davis.
Davis second.
Linger. Pat had said it.
Oh.
Patty, oh, I'm sorry.
Not me.
Hook up the fuel, we're gonna give Pat gas.
I'm not on your.
Moving right along.
All in favor? Opposed? I'm losing control. Number nine, awarding bid for gasoline. I'll make that.
Lennon.
Mr. Lennon seconds it. All in favor?
Aye.
That's carried. 10, awarding meat, canned goods and frozen supplies bid Ginsburg.
Eulich.
Overblock.
Ms. Overblock seconds it. All in favor?
Aye.
Oh, that's carried. 11, approving individual provider contract, preschool special education program.
Davis.
Davis, well, Mr. Lang,
Davis leg.
all in favor?
Aye.
Oh, that's carried. Sounds like the same one, but number 12, approving individual provider contract preschool special education program.
Davis.
Mr. Davis, Mr. Lake seconds it. All in favor?
Aye.
Opposed, that's carried. 13, authorizing conference attendance. Renze Usuni or whatever, I messed that one up, I know it is. Greene County Family Planning.
Lennon.
Overblock.
Leonard, try pronouncing that, somebody, all in favor?
Aye.
Opposed, that's carried.
Farzana Musami.
You got it?
Good girl.
Smart. You're smart. 14, authorizing conference attendance. Mary Ann Powers, FNP BC, Greene County Family Planning.
Overblock.
Ms. Hope.
Davis.
Davis second, all in favor?
Aye.
Opposed, that's carried. 15, establishing capital project 151 Youth Fair Butler Building.
Lennon.
Mr. Leonard and Mr. Hobart second. All in favor of that?
Aye.
Opposed, that's carried. Sounds like a good project.
It is.
It's going to Carroll, why not? Number 16, budget amendment, GRC Emergency Service Capital Project 135-2021, statewide interoperable communication.
Hobart.
Hobart.
Davis.
Davis seconds, all in favor?
Aye.
Opposed, that's carried. 17, authorizing agreement and budget amendment, Greene County Public Health Department and Health Research, Inc., Public Health Emergency Preparedness.
Overblock.
So, who else?
Like,
Mr. Blake. Speak up, will you? All in favor?
Aye.
Opposed, that's carried. 18, authorization to pay claims highway.
Hobart.
Build section, all in favor?
Aye.
Opposed, that's carried. 19, authorization to pay claims, Mark.
Hobart.
Hobart second, all in favor?
Aye.
Opposed, that's carried. Tonight, we have deputy treasurer with us. She has some words of wisdom and whatever.
Good evening. The finance report for the month of June. Collection of the delinquent taxes was up a little bit in year to date through June. A little over $300,000. The delinquent taxes, there was an increase in just over $1 million. And that's probably because we didn't have an auction in 23. So they're higher than they were. And sales tax continues to increase. It's just shy of $1.5 million over 23 year to date. And the town collectors are winding down this month, and they'll start coming in to turn over their books and final payments first 10 days of August. So, do you have any questions?
Only one meeting going on here, Barry.
I know, I'm sorry. So I'm complimenting you on the intake of the 1.5 over. I mean, you know.
She's shopping, Harry. She's shopping.
It's shopping.
Tomorrow.
It's only because people are spending
No, thank you.
more for less.
No, thank you very much for your report and, you know, doing what you're doing in the office.
Thank you. I apologize for missing the last two meetings. I had pre-planned vacations. So.
Understood.
Can't hate you for that. Priorities, everything going right? Sounds like that. Anything else come before? Fine.
Motion closed.
We're closed, thank you.
So up in.
Well, that was great, Charlie. You didn't even lose control.
Hey,
I was a little concerned, but you know.
Good thing you weren't here, otherwise we'd still be.
Matt, thank God you were there.
Yeah, well, I thought I'm outside the convention. I don't know if you can see me.
Oh, yeah, there you are.
Can you see us? There's Brent.
Hey, Brett.
There he is, right there.
Control.
We got everything under control out here. Don't you worry about it.
That gold hat. What you doing?
That's gonna be the new hat he wears. It's the gold one.
All right.
I'm gonna put that right on my desk in there.
You get it signed yet?
Not yet, but I bought some pens in case I see him. I'm gonna ask him to sign it for me.
All right.